Hello, everybody. How you all doing today? And welcome to this week in supervision, where we talk about some of the things that I have discussed in supervision with my supervisees throughout the week. And we're happy to have you. We're going to jump right in. We're going to be talking today about borderline personality disorder, BPD, in clinical practice, identification and assessment tips. We're hoping that some of what we talk about will help you better identify some of the symptoms in some of your clients, and also familiarize you with maybe a a comorbid that you may not be very familiar with. And we're going to get into it. Okay, it's a lot to cover for today, and we want to kind of consolidate things. So, have you ever had a client who has borderline personality disorder? Do you know the symptoms right off the bat that represent someone who has borderline personality disorder? That's something that we're going to talk about. And if you don't know that off the top of your head, we're going to help you by the end of this video to have some support where you can identify those symptoms much more clearly, faster, and maybe also we want to show an example of what it looks like to be engaged um, in a session, a brief session. We're not going to show the full session with someone who has this diagnosis. Now, how we like to do is I like to start off, of course, many times with a test question. Usually before that in supervision, what we'll do, even before the test question, is ask the supervisees if they have had any case scenarios that they would like to discuss. But then we go on and get into it, and that's what we're going to try to do right now. And I'm going to start with a question, a test question, and see if you can identify what is being discussed here. Now, I cannot. Here we go. I'm trying to share my screen here. Um, okay, and I didn't clear my bag out. Okay, let's go on and share this question here. All right, see if you know the answer here. My supervisees found this fascinating. I've talked about this sometime in the past, but not recent. But let's go with it, right? Which of the following statements is true about the comorbidity between borderline personality disorder and eating disorders? A, borderline personality disorder is more commonly associated with BED than with anorexia or bulimia. B, individuals with anorexia and bulimia frequently have comorbid BPD diagnosis. Or borderline personality disorder and eating disorders are related, um, I'm sorry, are unrelated and rarely co-occur. Okay. What do you think it is so far? All right. Lastly, eating disorders are a protective factor against the development of borderline personality disorder. So I give them time, as I'm giving you time, to figure out which one do you think is the correct answer. And the correct answer for this one is B. That is the correct answer. All right. The correct answer is B. And what it is, it depends on which study that you come across. Man, I should have put the other question on here too. But well, I think I have that. So there is a correlation with borderline personality disorder and eating disorders in general, specifically anorexia and bulimia. And a few studies, or this one study in particular, showed that 25% of individuals with anorexia and bulimia, and 28% with bulimia, had comorbid BPD, indicating a frequent overlap, especially with emotional dysregulation and impulsivity. So there is a connection and correlation. Individuals with borderline personality disorder often seem to have eating disorders very frequently as well. So this doesn't always happen, but there is a strong correlation. So when you are evaluating and trying to identify if someone that you are seeing has borderline personality disorder, you find out that they do, you want to keep this in mind that it's a strong possibility that they may also have issues or concerns relative to eating disorders. All right, we got another question that kind of piggybacks on this. I wanted to make sure I did that. We got to hurry up. Okay, in inpatient psychiatric settings, approximately what percentage of patients with borderline personality disorder also meet the criteria for eating disorders? Okay, so when you go into an inpatient setting, approximately what percentage of patients with borderline personality disorder also meet the criteria for an eating disorder? And we have A, 64%, B, 28%, C, 14%, and D, 80%. Okay. And this is based on certain studies. And so it's just good to know that this thing exists and then we want to rule these things out when we're making assessment. But let's go on and go to the answer. The answer to this one is, oh, maybe I didn't put it on here. Here we go. The answer to this one is A, 64%, a whopping 64%. And research indicates that in inpatient settings, nearly 64% of individuals diagnosed with borderline personality disorder also meet criteria for eating disorder. Now, notice what was the difference between the first question and this one? The difference is that we are talking about inpatient. Okay, so there's a stronger correlation with individuals who have borderline personality disorder who are inpatient who also have a diagnosis of some sort of eating disorder. So that's something to keep in mind. We don't have time to go into the details about it, but that's how we started out. We had a number of other questions too. All right, and so I want to. What does it look like? Working with someone who has borderline personality disorder. I want you to think about symptom wise. What are some of the common symptoms of someone who so if they came into someone who had borderline personality disorder, walked into your office, how would you know that this is the condition that they have? What's common? What should you be looking for in assessment? What type of treatments often? I might not get to this because it's not in my notes, but I want to ask you this question. This is what I ask my supervisees. What is the one of the top evidence-based interventions or interventions for clients who have borderline personality disorder? You know the answer to that. Okay. DBT. DBT is one of the number one recommended treatments for individuals with borderline personality disorder. But we got to hurry up. Let me see. 3:39. So we're gonna walk through this because this kind of I like because not all of my supervisees are engaged directly in psychotherapy, and so we often want to give them a view of what it looks like because sometimes I'm not gonna lie, some of us get a little bit intimidated by certain disorders and things like that. So we want to give them a real picture if they're not directly involved. And for some of the individuals that are already engaged in psychotherapy, they can get another look too, another look too. But just before we do this, I do want to remind everybody that we have a social work supervisor training coming up. Just take a second. Social work supervisor training coming up next week. So if you're needing to jump in, if you're needing some CEUs, if you're wanting to become a supervisor, come check us out. And we hope to see you there on Monday, this coming Monday. And then next, we have the DSM-5 TR. We just released a new DSM-5 TR training for some of you that have already taken the other one. We have a brand new one for you and would love for you to check it out for those who have their LICSW or just need CEUs in general. This is required for all those who have a LICSW. You would need to get a DSM-5 TR training somewhere. We hope you come and join ours. All right. And this is online, it's self-paced. All right. So let's hear a little bit from a client here who is being seen by a therapist who has a diagnosis of borderline personality disorder. And I'm so hoping that let me just stop this because I'm afraid, super scared that I don't have the audio tapped in here. So we're gonna just try it again. And here we go. All right, let's take a listen.
But I really don't think I did.
Yeah, so it's been about 8 years since you've overdosed.
Right.
I want you to be looking and thinking and hearing, observing if there are any symptoms that you're seeing. What's being demoed here? Are there identifiable symptoms that if you're talking to this woman that you see line up with borderline personality disorder?
And how did that happen?
2012, sorry.
So
Yeah.
it's seven-ish years?
Yeah. A while, yes.
Yeah. So in that moment, you decided to stop doing it. And then
Let's go back.
What you want. Like, this is not what you want. And I don't think I overdosed again after that.
when was that?
Maybe 2011 was when the majority of them happened. So I want to say 2011. I don't think I did it again after that. It's a blurry recollection, but I really don't think I did.
Yeah, so it's been about 8 years since you've overdosed.
Right.
And how did that happen?
2012, sorry.
So
Yeah.
it's seven-ish years?
Yeah. A while, yes.
Yeah. So in that moment, you decided to stop doing it.
Because it was scary.
Scary to you.
Yeah.
And
She was having suicidal
manage?
attempts.
Well, I went to the
Multiple.
hospital. Yeah, obviously they took me in, and then I was there for, it's usually like a 1 week stay. I'm pretty sure that was a 1 week stay. And then I got out again, and then I wasn't better, but eventually you just get better, I guess, right? Don't people just get better a little bit? Or do they just avoid, as I've learned from my last session?
A little bit of both.
Yeah.
I think there is something about the natural course of borderline personality disorder where you're right that people, I don't know, a kind of generic word is mature, and how much brain development goes into that, how much life experience goes into that, and how much just the emotion regulation that you said gets better over time.
Right.
We don't know.
Yeah.
But I think that there is also sometimes some avoidance that goes into why people stop exploding in the way they do. So it sounds like the suicidal explosion stopped about 7 years ago. And is that when these kind of outward moments of destroying your computer or doing something else angry got worse, or was that going on all the time?
That would have been like a really just pervasive issue throughout. Like, I wasn't allowed to be angry when I was a child. And I think that actually is probably why it got to be so bad. So I wasn't allowed to have like emotions or feelings, or my mom would say things like children should be seen and not heard. And so like, even if I were to like I just remember once, like, she just like beat me up in the car, and I didn't know what I had done, but basically like I hadn't clapped correctly or something. And it was just sort of like, it was that we'd gone to the symphony and like I hadn't like done it correctly. Like maybe I went like this and I should have gone like this, something just really ridiculous. And, but I wasn't allowed to be angry, and I wasn't allowed to have like emotions that I think like children should be able to have. So maybe when I was like on my own, then like it just got worse. I'm not sure. I'm actually not really sure, but that was always a problem.
You are on to something. So back then, how old were you at that time?
That was like my whole childhood.
Right.
Yeah.
But that memory, it seems specific.
You know, I was a teenager, so.
Do you remember how you felt?
Yeah, I always remember that. Just like trapped and like weak and incapable of like defending myself, and just sort of like, just like, like that, like just like that. Like, there was nothing I could do. I could really, literally nothing I could do. Yeah, defenseless, yes.
How does that link up to the problems of anger eventually? You weren't allowed to express anger, but eventually you were expressing anger in all these ways.
And it's freeing.
Yeah.
Yeah.
There's something empowering about it.
Yeah,
right?
definitely. You're right. Definitely. And it's not good that it's like linked with that, but yeah, definitely. And I was like,
Is it not good?
That's a judgment. I know, but it's not good, I think. I know. Okay.
You just said a minute ago that you thought that it was kind of bad for you that your mother didn't let you express anger, because a child in that
you're right.
situation
Yeah, you're right.
should normally be able to express anger.
Or just an emotion. Yeah, I know what I mean. They're just emotions. But yeah, no, you're right. There's got to be like a healthy balance there.
But is there something adaptive about the fact that you would let loose about this anger thing? Because I think feeling angry and acting angry, there's something pretty liberating about
No,
it.
definitely.
Like everyone likes to break shit once in a while.
Do you?
I do.
When have you broke? Okay, sorry, we don't have to, but like,
Actually, one exercise I do with patients is that, you know, these painted ceramics that kids make? I have about 100 of them. Okay. And I bring them in, and I bring in a hammer, and we whack them to death.
Well, it is therapeutic.
What do you think is therapeutic about it?
I'm not sure. There's a
What
release
happens when
there.
you, yeah,
There's a
release of what?
I don't know if endorphins. I'm not really sure. Like feelings.
Feelings.
Yeah.
Yeah, another thing I like to do is take glass jars and throw them into dumpsters when they shatter all over the place.
So what is it about phones? Like I feel like I'm not the only one who has like this like it's always a phone that I'm breaking. Like is
You
there
tell me.
No, it's not just me though. Like I've been in like anger management classes and like they broke phones too. Like is it what the phone represents? Like this communication tool? Like is that what it is? I've gone through so many phones. So many phones. I mean, I just don't even get like a nice phone anymore.
That's pretty adaptive. But I do think you're right about it, is that there have been many broken phones in the program that I run.
Yeah.
And oftentimes, probably more often than not, the thing that people break that's not the object I've given them to break
Yeah,
on purpose
is the
is the
phone.
phone.
Yeah.
But I want to sort out with you, what are the kind of maybe functional or positive ways in which breaking things helps you emotionally? And where's the problem with it?
Well, it's a release, like we talked about, right? It's a release. And it's empowering. And it's like a way to get back control, maybe?
Yeah, I think that's right. I mean, there's something about putting force into something and watching it transform.
Yeah.
It's like having an impact.
Yeah.
And I do think it's true that a minute ago when you were talking about this situation with your mother, you felt like you didn't matter, defenseless, and you needed to kind of protect yourself in a way. And I do think that sometimes the lashing out is this kind of available force of empowerment, but there are downsides,
Clearly.
clearly. First of all, the temporary lack of access to your phone or your computer.
It's crippling. Yeah.
Yeah. But what else about it is...
Okay, I better stop it here. This, as you can see, this is very interesting and fascinating, this exchange. But 39, 40, 49. Ooh, I gotta hurry up, sum this up. Okay, so I want you to think again about what are some of the symptoms of borderline personality disorder. Okay, so if you ever had any trouble with that, this is a mnemonic that you can use, and the mnemonic is impulse. Now, when I say that this mnemonic is so perfect, because when we're talking about borderline personality disorder, we're talking about someone who generally has issues with impulse control. So the mnemonic is impulsive, okay? And so this is a breakdown of the mnemonic. But look at how lovely this lines up with what's actually in the DSM, okay? And so this goes over, and you can see, take this out. I deleted it, but it came back. I'm sorry. I don't know what happened. Impulsive, okay? Impulsivity in at least two areas that are potentially self-damaging, okay? Uh, Moodiness, affective instability due to marked reactivity of mood, intense episodic dysphoria, irritability, all right? And so we can see, individuals who have borderline personality disorder often experience dissociations on a frequent basis or often. Okay. And so these are some of the symptoms. Okay. We got to jump ahead, right? So listen at the dialogue. We know that many times individuals who experience symptoms of or experience borderline personality disorder, there has been a significant level of trauma. And just in those few minutes, what did you hear that sounded like trauma that she had experienced? Okay. And she said something that was crucial. I wasn't allowed to be angry. Okay. And what we could see is the result of that from her mother not allowing for her to emote. She didn't seem to develop a way of functionally emoting her experiences, her feelings, right? And so we can imagine that from the sound of it that she's functioning often in the sympathetic, okay? That's the fight or flight mode, fight, flight, or freeze, which is not healthy for us, not healthy for our body. What we also heard her talk about was physical abuse, what it sounded like from her mother, and then also what seemed to be like emotional abuse. So we're looking at sometimes the things that may bring about, these symptoms that end up disrupting our clients, right? And so we talked about that as well. What symptoms did you see? right? From just that small conversation, what symptoms did you see? And we talked about that with the supervisees. What did you see? Well, we saw impulse that she seemed somewhat impulsive. We saw that that she had suicidal multiple suicidal attempts according to the DSM right here. Suicidal behaviors, recurrent suicidal behaviors, we see that she had that, right? Inappropriate anger, destroying computers and phones, not being able to properly regulate her anger. So this is what we're going to help and support her with, right? If she's our client. Unstable relationships, difficult. I don't know if that showed up on here. Difficulty maintaining because of the monster in her. That part did not show up. We didn't show that, but you can see that. I'm going to clip the video. Moodiness, and really, we only need 5 of the 9 criteria in order, if I'm not mistaken, in order to qualify or meet the requirements for borderline personality disorder, right? And so these are some things we're learning. She talked, if you looked at the therapist talked about some interventions that was pretty interesting. And I don't know how many of you all have heard of destruction or rage expression therapy. And I'm probably going to bring that back and talk about that a little bit more. But this is something that when that is used when you basically are destroying things. This approach, and what's the purposes of it, because that's the thing. If this approach allows controlled intentional release of rage or internal tensions. And so what does that look like? Well, sometimes we have suppressed anger that needs to come out because we're taking it out in less than constructive ways. Okay, so this is a way to start kind of getting a touch on that anger. Okay, making it real instead of allowing it to come out in ways that are unconscious sometimes, right? And if we're looking at this destruction and rage therapy, some ways are like what comes to the top of my mind is like smash rooms. And if that sounds very appealing to you, you might have anger issues. No, I'm just lying. All right, but yeah, but I like that though. I'm feeling like a smash room. I haven't been to one like a rage room, but you're just breaking up objects and things like that. So these are examples of some things that you might do. But we're not just smashing things for the heck of it. We're actually going to process what's going on. There's a reasoning behind this. Along with the talk therapy, we're getting the opportunity to physically express ourselves in a more constructive way and then process that. So if we were involved with that, we might say something like, we're going to create a safe outlet for your anger. I'd like you to write a phrase you've been holding in on the ceramic plate. When you're ready, we'll smash it safely into the padded bin. Then we'll talk about what that stirred up for you. So this is a way to kind of get to that anger, make it comfortable. After you feeling that euphoria of smashing something, maybe we can talk a little bit about what brought you to the point of anger with this. How much have you been verbally expressing it? How much have you found that your expressions have come out in unhealthy ways as a mechanism of trying to get the control back that you never had, if we're going psychoanalytic, that you never had when you were a child? And that's what we saw in this video. I hope this is helpful. We better end it. I'm over time. Thank you all for taking a look here, and we're going to try to pick up on this on